Okay, so today we're going to be presenting on respiratory training techniques. These techniques are used to address a variety of voice disorders, including those characterized by hyperfunction or reduced breath support. So this is an outline of what we're going to be covering in this video. First, we're going to provide a brief case history of the client, covering basic but relevant information. Then we're going to introduce each of the therapy techniques alongside a video demonstration. And finally, we're going to go over some treatment goals that could be tied to this mock case. So the client is a 24-year-old female. She was self-referred due to concerns with her voice, specifically tension in her neck and the frequent occurrence of running out of air when she's speaking. A voice evaluation was conducted by an SLP, during which it was found that the client had reduced breath support and a hyperfunctional voice. Voice therapy will address these issues, which is what we'll be demonstrating today. Our 5 techniques include easy onset, the yawn sigh, diaphragmatic breathing, sustained vowel productions, and the use of functional phrases. So our first therapy technique that we're going to view is easy onset. Basically, this technique involves instructing the client to add H or H to the beginning of utterances to reduce hyperfunction. Easy onset opens the vocal folds before phonation occurs, which prevents the vocal folds from slamming together with that hard glottal attack. As a result, there's less strain or hyperfunction on the vocal folds. In the video, you'll see that this technique is easily explained and implemented. Training begins with adding the H to syllables such as ha and ho, but can be used with longer utterances as well. Prior to what we'll see in this video, the SLP will have explained what easy onset is to the client, emphasizing its success with reducing the hyperfunction that they're experiencing with their voice. Here's our first video.
Now we're going to work on the easy onset strategy. So we're going to say some vowels. We're going to put an H sound in front of it. So like, so when you say you put an H in front of it. So you'll say ha, ha. Let's do another one. So if you say E, you'll put an H in front of it and go he. And then if you say O, you'd say oh, ha.
Okay, so that was easy onset. Oops. So next is going to be the yawn sigh.
Yes, so this technique is called the yawn sigh, and the purpose of this technique is pretty much the same as the easy onset technique. It involves having the client take a yawn and then release it as a sigh, which eases into phonation. This technique is useful for opening the vocal folds prior to phonation and thus preventing the hard glottal attack that many clients experience with hyperfunction. This technique can be used with easy onset and a variety of other techniques in order to decrease strain and promote healthy vocal quality. So in the video that we'll watch, you'll see the clinician instruct the client to use the yawn sigh with short CV words such as ha and ho. And afterwards, they'll practice the technique with longer words and short sentences. And as the client gets more accustomed to this technique, the clinician has her begin to turn the yawn sigh into more of an easy onset, having her open her mouth and begin the utterances with the sound. So it's less of a yawn and more just opening her mouth. So we'll watch that video next.
Okay, so now we're going to work on a strategy that's going to reduce the tension in your vocal folds and help open up your airway. So we're going to start with a big yawn. Like when you're very tired, you yawn and then you sigh like this. You want to give it a try? Do you feel how that's relaxing? So we're going to try to add that in with some words, some short little and now we're going to do a little bit longer words. So we're going to do hello. Hello. now we're going to get even longer. We're going to do 4 to 5 words. How are you doing?
How are you doing?
Have you eaten dinner?
Have you eaten dinner?
Mm-hmm. And so slowly we're going to replace that yawn with just opening our mouths, similar to the easy onset that we did before. We're just going to ease into words with the H sound. So you're just going to open your mouth and say, hello.
Hello.
Mm-hmm. Good. How are you doing?
How are you doing?
Mm-hmm. Good. Do you feel how that's relaxing?
Yeah.
Okay, so now we're going to...
So the next therapy exercise is diaphragmatic breathing. This technique addresses both reduced breath support and hyperfunction. It involves training the client to breathe efficiently using their diaphragm. And by doing so, the client improves respiration, increases subglottal pressure for phonation and speaking, and decreases strain. Diaphragmatic breathing reduces hyperfunction and promotes better adduction and abduction of the vocal folds. And so in the video, you'll see that the clinician explains the purpose of diaphragmatic breathing and has the client first sit with correct posture. Then she leads the client through several deep breaths, encouraging diaphragmatic breathing rather than shallow chest breathing up here. We'll see that in the video.
Okay, so next we're going to talk about diaphragmatic breathing. So we want to think about breathing as efficiently as possible. So I want you to sit up straight with your legs on the ground, a little bit apart, knees straight. And I want you to put one hand on your chest and one hand on your diaphragm down here. There you go. And so we're going to take some deep breaths in through our nose and out through our mouth. We're going to breathe in for 4 seconds and out for 6. And when you're doing so, I want you to think about having the air come from down here and the tightening from down here rather than at the top. So ready? We're going to go in. Do you feel any tension up here?
A little bit, but
Okay.
I did feel my hand move.
Yep, try to focus down at the bottom.
That felt better.
Mm-hmm. And we're going to go in again. Good. Okay, so now.
Okay, so the next therapy technique is a commonly used activity in voice therapy. So this one's the sustained vowel. So this technique involves producing a vowel sound, such as ah, for a given period of time to improve overall breath support and coordination. This technique is beneficial for many reasons, as it improves vital lung capacity and therefore improves vocal volume and speech intelligibility. Sustained vowel productions also aid in the coordination of the intercostal muscles. And finally, sustained vowel productions help to practice coordination of the respiratory, phonatory, and articulatory speech subsystems. So in this video, you will see the clinician instruct the client to produce a sustained vowel or a loud ah sound.
All right, so what we're going to do next is a sustained ah. So I want you to hold ah for at least 5 seconds. So whenever you're ready.
Ah.
All right, you can stop. Let's do 2 more, just like that.
Okay, so the next technique is the use of functional phrases to improve breath support and coordination. So this technique provides plenty of practice opportunities and encourages the client to consider the pacing of their respiration during phonation. So functional phrases can also help to strengthen the muscles used for speech, which will help with decreasing hyperfunction. This technique is one that would be great to implement the easy to hard hierarchy, allowing the client to practice shorter phrases before moving forward with more complex phrases. So in the video, you will see that the clinician provides a list of functional phrases to the client. This list was made during a previous therapy session and includes phrases that are relevant to the client's everyday life. The client reads through each phrase and is instructed to consider the pacing and the coordination of her respiration while doing so. So for some clients with even lower breath support, the clinician may also adjust her prompts to encourage the client to take breaths halfway through a phrase.
So now what we're going to do is read some functional phrases. So the goal of this is just to reinforce the use of breath support when you do coordinate your voice with when you speak. So I have a list of functional phrases, and you can read through each one and just keeping in mind of all those strategies with regards to like your breath support, and we can monitor as you go through.
Okay. Can I just say them once?
Mm-hmm.
Hi, Bill. How was your day?
Nice. We'll do the next one.
See you in class on Thursday. What time do you want to eat dinner?
Let's stop right there. So I think for the next one, trying to monitor your breath support while you're going throughout the phrase. So taking that deep inhale, and as you're speaking, trying to coordinate your breathing pattern with the phrase you're stating.
Should I do that one again, or just?
Sure, you can do that one again or go into the next one.
What time do you want to eat dinner? Where are you going on vacation? I would love some Oreo cheesecake.
So now
we're going to read through some treatment goals that are relevant to the demonstrated treatment techniques. So for our first long-term goal, we said that the client will decrease laryngeal tension and hyperfunctional behaviors to reduce vocal pathology. Our first short-term goal is that the client will utilize techniques such as easy onset, Yansai, and diaphragmatic breathing to improve vocal quality and reduce hyperfunction in 80% of opportunities over 4 consecutive sessions. And our second short-term goal is that the client will identify and self-correct hyperfunctional behaviors like vocal strain and or laryngeal tension during structured activities in 80% of opportunities over 4 consecutive sessions. And our second long-term goal is that the client will increase breath support for functional speech across all contexts and environments. And our short-term goals for this are the client will engage in therapy exercises like diaphragmatic breathing and functional phrases to generate and maintain adequate breath support in 80% of opportunities over 4 consecutive sessions. And the client will produce a sustained vowel, such as ah, for 3 to 5 seconds in 80% of measured opportunities over 4 consecutive sessions. And for our wrap up, just to reiterate, our client presented with reduced breath support and hyperfunction, and respiratory training therapy was recommended. The goal of our therapy is to restore the client's voice and provide the tools to maintain a healthy voice. And self-monitoring along with practicing vocal hygiene and other strategies learned in therapy is vital to the client's success. That's it.
Thanks for listening.